Our guest in this segment is Tanya Manley. She is the head nurse at the Berkeley County Health Department. Good morning. Thank you for coming back.
Thank you. Thank you for inviting me.
Well, you're quite welcome. Yeah, you are always welcome on the show because you have the knowledge that we need when it comes to the health department.
Probably only a fraction of what's out there.
Well, it's the fraction that we need, though. Yeah. School is about to start.
Yes.
And there are some folks, I'm sure, who are still confused about vaccination requirements for this school year and who we're all answering to. Can you help us understand that a bit?
Yes. The state of West Virginia are still following the required vaccines, and there are certain ones for school requirements, DTaP or Tdap, polio, MMR, varicella, and Hep B. Those are the required ones.
And some of those are different based on the grade that you are going into?
Exactly. Based on the age of the child, there are certain requirements, and you get them based on your age.
I am sure that all parents are completely ahead of the curve and prepared to start this school year and that you have no rush of last-minute appointments at the health department.
The phone, and we also have on our website the ability to drop an email and request an appointment. But it has been extremely busy over the last 2 weeks, and we're trying to meet everybody's needs, but we can, there's certain protocol that we follow for scheduling an appointment, and we are doing the best we can to give the immunizations.
If I call you today and say my child needs an appointment to be in school tomorrow, what are you telling me right now?
Probably we're looking at about August 28th.
So that's not tomorrow.
No.
Yeah.
And I think that the school does recognize if you have an appointment and you show that you've got an appointment card and the appointment's coming up, that it's not a problem with going to school.
You can go to school without the shots so long as you're scheduled to have them?
Right.
All right. What are the exemption rules that we are following this school year?
With West Virginia, they do allow the medical exemptions, but the Board of Education is still following the state policy. And for any religious or philosophical, they are not accepting them.
Not yet?
Not yet.
But a court decision may change that?
That's what I hear, yes.
All right, very good. What grades is it? What is it? First time in school, kindergarten, or does pre-K now apply for the vaccination requirements?
There are for pre-K for preschoolers. There are certain doses that people are required to get. Hep B would be 3 doses. The DTaP would be the four doses, but the 4th dose is usually after the 4th birthday. Varicella, at least 1 dose after the 1st birthday. And the polio is 3 doses. And then, of course, the measles, mumps, and rubella.
Okay. Now, if I schedule this through the health department, is there a charge?
We have a program through the state, Vaccines for Children, that if people have Medicaid, CHIPS, or are underinsured or uninsured, we can give vaccines through the VFC program. But if somebody has insurance, we do prior authorization, and we will take people who have insurance.
Mr. Stubblefield.
Yeah, a couple of questions. One, let's go the vaccination. You mentioned everything's going to be decided with a court case. I suspect you have to be prepared to give them the larger number of dosage. What is the shelf life of some of these vaccinations? If you don't use them, what do you do with them?
If they expire, we are able to send them back to the company, and they give us credit on our account for what we've sent back.
Okay, so it's not okay. More basic question, maybe outside of your level of involvement, but this past few days, it's been announced that there's a major cutback on funding for mRNA, which is the messenger RNA that they use for updating the strands of COVID and the flu and others. For us laymen, what impact is this going to have, the cutback on mRNA?
Well, I would think that with making the vaccine, the COVID vaccine for this year has not been released yet. We have been getting state COVID vaccines through the VFC program, but if you do not qualify for that program, then it is required that you have insurance or you pay upfront for it. We have not had any problems in the past getting the COVID vaccine, but we have not had a lot of people request it now that they have to pay for it.
Yeah,
so
mine was a kind of a different question. The cutback, the substantial cutback in research and preparation with the mRNA. Will that impact this year, or is it a downstream problem that we're going to be facing?
I would think downstream, because from what we've been told, it's any day that they're going to release the vaccine for this year. So I think that probably maybe next year, seasonal, it will affect that, but not currently.
Okay, thank you.
Mr. Gilstrap.
Yeah, actually, I'm going to steal a question from one of our listeners, Jeff Haddix. Kind of a generational thing. When I was a kid, when it came time for vaccinations, the kids lined up in a hallway outside the cafeteria, and you just got your shots. You got, one after the other. I guess that's just not done anymore. We have to come to you?
No, because what happens is when someone calls the health department to make an appointment, we require verification of vaccines. If you have not received vaccines through us, or there is a state database called West Virginia SIS, if your vaccine record is not in there, we require proof of what you've had. So the parent either has to send by email, fax, drop off, show us, make us a copy of what child vaccines have been done. And my little experience with going into the schools and giving flu vaccines, if we give vaccines to children, we do not do it in an area where everybody can observe. We do it in a private area, so it's confidential, because you don't want children seeing other children get vaccines.
So when you're dealing with vaccines...
We didn't care about that horror back then.
Oh, no, absolutely not.
You saw it full flush.
When it comes to vaccines, if you're not sure, do you err on getting an extra vaccine or not getting the vaccine?
No, if you're not sure, there is what is called, if there's, say somebody comes from another country or somebody has lost a shot record, then the CDC has a schedule of the recommended catch-up vaccines, and we do that appropriate to the age that the patient currently is, and we will give vaccines based on that schedule. But we don't start them all over and give them again.
There are several ways to get vaccinations in the area, both for children and also adults. You can go to your local grocery store, drugstore. You can go to the doctor's office. You can go to the health department. What is the coordination between all this? Who maintains the database? If I have a vaccination at CVS, for example, is that incorporated into your database?
It is. It is not. It's a state database. And I know that some of the places will enter, some of the physician offices enter. But the important thing is if that information is not entered, that the guardian, the parent, make sure that they keep the documentation, because then when they come to the health department, we will enter all immunizations into that.
Thank you.
All right, I want to shift gears to the other way. We're coming up on illness season, and one of the big problems that it's been a long time since I've had a kid in school, but I remember these these discussions. Send them, don't send them. We got real truancy issues in schools today. When do you keep the kid home? Because when is a fever a fever? When is a sniffle a problem? What are the rules for when do you keep the kids home?
The Berkeley County schools, they do have policy requirements, but anytime a child is starting to feel sick and they start running a temperature, and usually a temperature can be anywhere from like 1.5 to 2 degrees higher than their baseline, but a parent should be able to tell that. And if they are getting to that point, or if you know you've been around somebody who has COVID, or you've been exposed to somebody, a parent or aunt, uncle that's been sick, then there's a high potential in 2 or 3 days that child will be sick, and you shouldn't send them.
That's interesting. My temperature normally runs right around 97.1. So if I'm textbook normal, 98.6, do I have a fever?
For you, if you're 97, probably anything above 99.5, I'd be a little concerned that you're headed that way, yes.
Huh. Okay.
You're kind of chill.
Well, I'm always
97.1. Tanya Manley is our guest here. She is the head nurse in the Berkeley County Health Department. With school getting underway, we are discussing immunizations and such, and vaccines, which include flu shots and COVID vaccines. So that was one of the questions before we went on the air. John, had to do with flu shots, and you were wondering how they determine what strain they're going to use.
Well, I'm not a big proponent of the COVID shots, but I am a religious taker of the flu vaccine, only because I've had the flu and I really didn't like it. But I know there's there's a science by which they choose which variant of the flu we're going to be vaccinated against this year. Do you have any insight into how they decide that, and when that decision is made? Because they got to make a whole bunch of these.
Right. Well, I'm not sure of the exact cutoff point, but I do know that when the epidemiologist follows the number of flu A's, the number of flu B's, and we're reporting to the CDC what types of flu are out there. There are people working in laboratories who study the strands of these type of flus and also COVID, and that is how they determine what the flu shot and the COVID shot makeup is going to be for the following year.
So all the manufacturers use the same recipe for both flu and COVID, the different ones. In
There
other
would
words,
be different ones,
Yeah.
and it's
but
manufacturers do their own different studying, and I think also with vaccines, some vaccines aren't interchangeable. If you start with a certain brand and you need to get the next dose of the series, then you need to stick with that brand and not go with another one because it's $10 cheaper.
Okay, so if I have, and I'm drawing a blank on some of the manufacturers now, if the recipe is not the same,
No.
so I could get much more success from one pharmaceutical company than I could another pharmaceutical company.
Or it depends on how you react to the vaccine, because some people stuck strictly with Pfizer, and then Moderna comes along, and we may not have Pfizer, and we carry Moderna, and they'll say, well, I'm okay with taking that. And now that the COVID vaccine is made each year based on what is currently out there, then it's going to be a little different than in the beginning of time when we started and we got the base dose series and then got boosters.
So let's talk shingles vaccine. Another vaccine that I got, and
another text we exchanged.
yes. What is the special breed of evil that is built into the second dose of the shingles vaccine. That was it comes with its own baseball bat and blowtorch that just kind of
It beats on you for a week.
Yeah, I just think it's how people react. Sometimes you get the first one.
not a problem.
Well,
First one's a little bruisey.
yeah,
but-
I can tell you it just depends on the person.
Yeah, I had no problem with either one of them, John.
Oh
Yeah.
my goodness.
Yeah,
Bill's much tougher than we are.
Yeah.
yeah.
Yeah, that was. I remember telling John about the second one, and I got a text about a day after he got it saying, "You weren't kidding about this." Oh my God.
Yeah.
That's what. But there's a whole bunch of shots you can talk about here, which include booster shots like tetanus.
Yes.
How often are you supposed
Every
to get
10
that?
years. Every 10 years. But if something happens that you have a major injury, you know, you step on a rusty nail, or you cut yourself with a knife or a shovel, when you go to the emergency room, the doctor may recommend one sooner. But the base is every 10 years.
Every 10.
I just had back surgery about 3 months ago. I had tetanus in there, right? I mean, most likely it was part of all of the cocktail of stuff that they gave me. I'm going to guess there was a
I wouldn't think so.
no.
No.
Okay. Because there were no rusty scalpels.
That was a sterile procedure. I would hope not.
Okay.
Yes.
Now, if this was 1881, John,
Yeah. Okay. That's
you're
well.
getting
Well, no, but it was
a different story there.
So let's go back to the recipe again. I'm intrigued about that because your answer really surprised me. So these CDC or their laboratories look at the various strains of, we'll stay with flu, look at the various strains of flu, and they come up with a cocktail they think is going to be most effective for that different strand.
Right.
Then they give this cocktail recipe to various manufacturers, Moderna, Pfizer, and the like. What I understood you to say is that the manufacturers are not obliged to stay with the recipe of the cocktail given by CDC. They can go ahead and prepare their own cocktail.
I think that the manufacturers have their own laboratories, and they're doing studying also. They just don't all follow the same recipe.
Yeah, that you may well be right. I just find
Yeah.
that very surprising. I thought they would be
Yeah.
a single guidance from that, and I do realize with Pfizer, if you start with COVID now, switching from flu to COVID, with if you start with one, you should stay with that one.
Yeah.
But I did not realize there was a range of protection,
Yeah.
very dependent upon the
Yeah.
manufacturer.
We have certain pediatric vaccines that it is not going to hurt if you switch over, but if you start with one vaccine, it's recommended that when you get the second series, that you stay with that vaccine. And another one may require 3 in a series, but the one you started with is only a 2-dose series, and then you're done.
Okay, so are you done there, Bill? Or you
No,
got more?
I was going. Michael Hornby, I waded into this discussion, and Michael may have provided the distinction I was looking for. CDC identifies the strain they're trying to go for to address. That would be in the flu strain, for example. Then the manufacturers would try to develop a cocktail to respond to that particular strain.
All right, trying to make people uncomfortable here because when you go back to school, you got all kind of kids, and who knows what they're bringing to school or taking home with them. So let's talk about some of the things that you get with kids. Head lice,
Yes.
the old hand, foot, mouth,
Yes, that's very popular.
right?
Yes.
And
hand, foot, and mouth.
yeah, well, go
Yeah.
ahead and talk about that one there, Tanya.
Yeah.
I thought that was a horse thing. Oh, that's hoof and mouth.
No. No.
If
It's
your
a-
kids have hooves, you got other problems.
Yeah, it's a virus that goes around, and it's very contagious, and the children end up with really red cheeks, and just it's viral and touching, and
What causes it?
it's a virus.
So it just occurs? Like anybody can just get it at any time?
Yes,
Really?
yes.
That's disturbing. How
Yeah.
how can you prevent it?
Hand washing.
Lots of hand washing.
Hand washing.
And don't hug children.
And don't, sharing water bottles, sharing food or straws or drinking after, you want to make sure that your child uses what is individually theirs, but really good hand washing.
All right. Head lice.
Head lice. That transfers usually a lot of times in the wintertime. Coats, hats, scarves. You hang them in a combination area. Kids usually bring them from home, and you may not be or realize that the child has them. Playing sports in the locker room, basketball team, football team, a lot of people in the area, and they can pick up head lice.
Is pink eye still a big mover? That was a big thing when I was a kid.
Oh,
Yeah.
pink eye.
We don't hear a lot of it.
Okay.
Ringworm.
Ringworm. That's a fungus. And
That's jock itch, isn't it?
Jock itch?
Isn't that jock itch?
No, that's different.
it's a little different, but ringworm is something that from the animals, cats, dogs, soil, and it gets under the skin,
right.
And it's a fungus that's treatable with antifungal cream.
And in regards to prevention of any of these things, what's the best way to prevent them?
Wash hands,
Be clean.
be clean, yes.
All right. What else is out there waiting to affect us?
You've probably mentioned the most popular things, but with flu season coming, last year it was flu A. COVID is still out there. It's not reportable anymore to the health department, so we won't know the true numbers, but flu A, flu B are reportable to the health department, so we have some idea what's going on.
I've had COVID 3 times that I know of. I think I'm done. Hopefully that's enough. So go somewhere else next year.
I think it's remarkable how right Mom was. Wash your hands.
And you're
wash
supposed to
your
sing the happy birthday song when you wash your hands.
Yes.
Now that you're washing long enough, right?
With a hip-hop beat to it.
Yeah. Tanya Manley, thank you so much. And if people need to get in touch with you at the health department, how can they do that today?
Our number is 304-263-5131. It would be option 1. And then also if you go to the health department website, you can log on there and request a immunization appointment.
But you should not expect to get an appointment tomorrow if you need vaccinations today.
No.
I like how you were very succinct
Wow.
with that answer. I
Yes.
like that. Thank you for coming in. Always a pleasure to spend time with you.
All right. Thank you.
I feel as if I need to wash my hands now, John. just to be sure.